This presentation will cover the typical contents of an inpatient medical record in a hospital setting. We will go over the information that is normally collected and the forms that are normally present in the record. Please refer to the textbook for detailed information pertaining to what will be discussed in this presentation. Before we get into the detailed medical record contents, it is first important to understand how data sets are used. Whether medical records are paper or electronic, it is important for them to be uniform, complete, accurate, up-to-date, and accessible. A data set is a list of data elements collected for a particular purpose. For example, an admission record would need all the data elements of the patient demographics, insurance information, emergency contacts, and so on. Usually, standard healthcare data sets represent the minimum list of data elements that must be collected. Some data sets are required, while some may be optional. Data sets allow for the same information to be collected on all patients and for this information to be standardized. This slide lists some of the different data sets that are used in healthcare. Please refer to the textbook for detailed data elements and their definitions. An example of data collection may be standardized in the demographics in a patient's date of birth. A date of birth can be written in many different ways. A data set may require a date of birth to be collected as a 2-digit month, a 2-digit day, and a 4-digit year. In an MPI, the date of birth field may require 8 digits total for a birth date in this format. If you have too many digits, or not enough for that matter, the MPI will give you an error message and not allow you to complete that field without the required number of digits. By standardizing the date of birth, you ensure every patient has their birth date captured the same exact way. There can be hundreds of forms used in the medical record in a hospital setting. Before a medical record is filed permanently, the forms and pages are put together in what we call a routine chart order or designated record set. This is a standardized arrangement of how medical records are assembled or put together in paper form. In an electronic environment, papers may be scanned into an EHR or electronic health record system that automatically saves the medical record in a routine chart order. This is done by the use of barcoding. A certain barcode will tell a page where it needs to be filed in an EHR. A routine chart order makes it easier to audit a record, for example. If you are looking for a particular item in a record, you can locate it much faster. As discussed in a previous presentation, the health record starts sometimes before the patient arrives. Information can be sent over to a hospital by a physician. In the cases where a patient arrives in the emergency room or through the admitting office, their file is started immediately. If the patient has been to the same hospital before, they are verified in the MPI and their old medical records are then pulled and sent to the unit the patient is on. This is what we call chart retrieval. A face sheet is also generated for that visit. This slide lists the type of reports that can be dictated by a physician or those with privileges to do so according to hospital rules and regulations. Dictation involves the physician speaking into a phone or recorded device about his findings on a patient. The voice file is then transferred to the transcriptionist for typing of that particular report. It is very important for the physician to speak clearly, provide identifying information on the patient, such as the name, date of birth, and medical record number if available, and speak in a regular tone with elimination of background noise. It sounds like a lot, but transcriptionists take pride in their work and want to produce high-quality, error-free reports. It makes their job harder when the dictator does not follow proper procedures. There are numerous steps in the workflow when transcription is involved. The physician first examines the patient. He or she then dictates the note either from memory or while looking at the medical record. The recording of the dictation is sent to the transcriptionist, who then types the report while listening to the voice file. Transcriptionists work with headphones attached to their computer while they type the report in the transcription software. The report is then sent back to the physician for review and approval. If there are any errors on the report, the physician notes the errors or corrections and then sends the report back to make the changes. The transcriptionist makes the changes and sends the report back for signature. When the final report is signed, it is filed on the medical record. If a patient has surgery, an immediate, post-operative, or post-op note must be filed in the medical record. Since dictated reports can take several hours to get back, a quick form is placed in the record with the required elements listed on this slide. For each surgery, a post-op note is required. This means if a patient has several surgeries in one day, each surgery will require a post-op note. The Joint Commission is one of the organizations that require a post-op note. Audits are normally performed to ensure a post-op note is being utilized and that the required elements are being recorded on it. Physician orders are one of the most important elements of a medical record. When you think about it, patients are treated due to a physician telling the nursing staff or ancillary staff what to do. This is through the use of physician orders. Hospitals exist because of physicians admitting patients and directing the clinical caregivers like nurses, technologists, and therapists. Physician orders, or doctor's orders, direct the diagnostic and therapeutic patient care activities such as medications and dosages, frequency of dressing changes, and so on. They need to be clear and complete, legible if handwritten, dated and timed, and authenticated or signed by the responsible physician. Before a patient can be admitted to a hospital, they must have an admission order by a physician. This admission order must state the diagnosis of the patient and what particular unit or area the patient will be staying on while in the hospital. In their orders, physicians are prescribing medications and requesting tests be performed on their patients. They must write orders if they want to transfer the patient to a different unit or area. Have you ever been a patient in a hospital or been with a family member and told you had to wait for the physician before you could go home? This is because a discharge order must be written as well by a physician. There are instances where patients decide not to wait for their physician and leave what we call AMA, or against medical advice. There is an AMA form that is signed by the patient and placed in the medical record if this occurs. This protects the hospital for risk management purposes in the event the patient was not well enough to leave. Other items the physician can order are medical equipment. Physician progress notes are where the physician can record his or her daily activities with the patient. Normally, a progress note is written each time a physician rounds or sees their patient. They write or dictate their findings on a patient and what the course of action will be. They contain statements related to the course of the patient's illness, response to treatment, and status at discharge. They also facilitate team members' communication because progress notes provide a chronological picture and analysis of the patient's clinical course. They document continuity of care, which is crucial to quality care. There are no frequency requirements as to how many progress notes a patient needs, such as once per day or 3 times per day, but they are documented based on the patient's condition. For example, a patient in ICU or the intensive care unit may have progress notes documented several times per day or at a high level of intensity due to their illness. A patient in a regular room or at a lower level of care may only have 1 progress note per day. Progress notes must be documented in a timely, accurate, and legible manner if they are being handwritten. Clinical laboratory reports document the results of laboratory studies and tests performed on a patient. Examples of reports include blood chemistry, blood glucose level, CBC, urinalysis, culture and sensitivity, blood gases, cardiac enzymes, blood types, and genetic testing. The lab reports also provide identifying information on the patient, dates and times of lab tests, and initials of the laboratory technician. Pathology reports are sometimes called tissue reports. They assist in the diagnosis and treatment of patients by documenting the analysis of tissue removed surgically, such as via a biopsy. A physician can send a tissue examination request to the pathologist along with the specimen and a clinical working diagnosis. The pathologist performs an analysis of the specimen and documents a report. He or she will document on the report if they support the working diagnosis. The report is then filed on the medical record. Data elements the report will contain are the date of exam, working diagnosis, final diagnosis, the tissue examined, any examination notes, and an electronic signature. Blood transfusion reports document the complete and accurate order for blood, report of cross-matching or compatibility tests, blood type, report of administration of blood, donor's identification number, and notes on any transfusion reactions. Radiology or imaging reports document the results of any radiology studies or tests performed on a patient. The actual report will document a description of the image, technique used, narrative report of findings, and impression or diagnosis. It will also be signed or authenticated by the radiologist. Just to clarify, the term authentication means to sign by the author. Authentication must also contain not only a signature, either handwritten or electronically, but also the date and time of authentication as well. An EKG report is a printout of graphic tracing of electrical charges in heart muscle, commonly called the EKG strip. A physician must interpret the tracings and authenticate it as well so it can be filed in the medical record. Anesthesiologists document throughout the surgical episode of patients. They first meet with patients preoperatively. This is where they perform a patient assessment to determine their anesthetic risk. They are also able to dose the correct amount of anesthetic for a patient. We know that anesthetic is a combination of drugs that put the patient to sleep during surgery. During the actual surgery, the patient must be continuously monitored. The anesthesiologist is responsible for monitoring heart rate, oxygen levels, blood pressure, and so on. These levels are recorded for documentation in the medical record. Lastly, when the patient's anesthesia is reversed, it is the anesthesiologist that is responsible for this process. Again, a combination of drugs is administered to the patient, and then they are sent to the post-anesthesia care unit or PACU unit for monitoring. The patient cannot leave the PACU area until cleared by the anesthesiologist. All of the PACU documentation is the post-anesthesia documentation. Anytime a patient has a device or implant placed in their body during surgery, an implant record is generated. This contains all of the information on the implanted device, such as the manufacturer, the size of the implant, the serial number, and what it is made of. The patient normally receives an implant card with the same information. Items such as screws, rods, artificial discs, and pacemakers are all considered implanted devices, just to name a few. Implant records must be kept permanently since they are in the body permanently or until removed or replaced. A brief mention needs to be made about pregnancy records. Expectant mothers will have many different forms contained in their medical record due to the constant monitoring that is done while they are in the hospital. Consent forms that are signed by patients or parents and guardians, if the patient is a minor, are also part of the medical record. There are different types of consents that are used in a hospital as listed on the slide. Before each form is signed, a member of the healthcare team should go over the items on the consent and answer any questions the patient may have. Autopsy reports are filed on patient medical records as well if performed. They are performed by a hospital pathologist or medical examiner. The report is to document the autopsy findings and to list the cause of death if unknown. Of note to mention are rehabilitation records. Just like labor and delivery records are special, they contain special forms that are used to monitor a patient's progression in outcomes while in therapy and rehabilitation programs. Remember, medical records contain information that is administrative and clinical in nature. Their purpose is still the same at all healthcare facilities: to provide patient care and document the care provided to patients.